Good afternoon, everyone. Thank you for joining PHCA for today's webinar, COVID-19 a Year Later. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've been doing through this crisis and thank you for all that you're doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending an attendance certificate as well. A survey will be launched at the end of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using the questions pane on the right hand of your screen, and our presenters will address them at the end of the presentation. Today's webinar will be presented by Jeff Beck, Senior Vice President with AssuredPartners, and Cathy Knopf with the Risk Management Consultant, Risk Management Solutions, AssuredPartners. COVID-19 has had a significant impact on the senior living healthcare industry within the past year. This presentation will discuss the regulatory implications COVID-19 has had with senior living communities, best practices in regulatory compliance, along with management of the survey process. We will also explore the impact from an insurance claims perspective. I'll now turn the webinar over to Jeff and Cathy.
Wendy, thank you so much, and thank you to Pennsylvania Healthcare Association for once again allowing us an opportunity to partner with you, and to all the attendees. We know you're extremely busy, so spending an hour with us today is something we don't take lightly. So thank you again for your time. Now, I'm thinking back a little bit. It's kind of amazing that the pandemic hit us a year ago. I think we've all been moving so fast and been scrambling that it's kind of crazy that it's been a full 12 months already. And you think about how it hit the general population. It's been a challenging year and an interesting one, to say the least, for all of us. But for the general population, most had to adapt to working from home, as they attempted to do their part in protecting their family and others from COVID-19. But then you think about many on this call and your team members. You guys didn't have the opportunity to work from home. Your healthcare heroes have been doing an amazing job caring for our most vulnerable population day in and day out, while they were dealing with the emotional, physical, mental stress that they in their households as well. So it has been a challenging year. And then you look at the financial aspect of it. There's been many financial difficulties that came out of 2020, and due to the increased cost of PPE in the labor market, in addition to the increase in average occupancy. So getting creative is key, and ensuring that you have partners that are aligned with your vision, and then others that put you in a position to execute that vision through a strategic plan. And luckily, I have two ladies on the call with me today that make me look good day in and day out by not just assisting in creating those visions, but also working with our clients on executing on that strategy. So Cathy Knopf is with us today, and Cathy is a risk management consultant for AssuredPartners. She manages an established senior living book of business in order to assist customers in minimizing exposure to professional liability lawsuits. She is responsible for scheduling risk management activities with assigned clients that include clinical and environmental risk assessments, education, mentoring, quick response review, action plan assistance, mock surveys, including survey preparedness, consulting services, and high-risk chart reviews, among others. She served as the Director of Nursing for nearly 12 years and has over 30 years of experience in the senior healthcare setting. She is a resident assessment coordinator, certified and nursing professional development practitioner. Also joining us today is Christy James. Christy is a senior claims consultant specializing in and advocating on behalf of senior living facilities. She possesses a proven track record of proactive claims management, identifying opportunities for risk reduction, and engaging defense counsel to obtain optimal claim outcomes. She has dedicated over 19 years with AssuredPartners towards the prevention and resolution of senior living professional and general liability claims. Her experience includes 5 years in the clinical risk management department, 10 years as a litigation manager for a professional and general liability third-party administrator. So as I said, I mean, there's many challenges that we have assumed, and unfortunately, some of those challenges are going to stay with us for the foreseeable future. So we hope that you appreciate the value that both Cathy and Christy are going to bring you today, and you could look to either incorporate that or maybe enhance that vision and execution plan that you do have in place for your individual communities. So with that, Cathy, I will turn it over to you.
Thank you, Jeff. I want to thank you personally, the audience, for taking time out of your busy day to spend a little bit of time with me. Being in the industry for as long as I have, I understand that on a day-to-day basis, things get crazy. When you add a little COVID into it, they're even crazier. So I appreciate the time that you're taking today. And I'm really pleased to have this opportunity to share, my brief synopsis of the impact that COVID-19 has had within our senior living healthcare industry over this past year. So I'm trying to think, when I was getting ready for this presentation, I was trying to think, is there anything different I can share with you? Is there, what kind of perspective can we give, instead of the same old, same old? So, I thought we would start with just a little bit of a history lesson, so to speak, in which a little bit of an introduction from history's point of view. And it's all, so when I was looking at this, I realized that infection control practices actually started back in the early 14th century. This occurred when Italy initiated a quarantine for all their ships coming from abroad, from areas known to be infected. When those ships were coming into Venice, they were required to do a 40-day docking before they were allowed to come on land in order to protect their people from the plague. So, the idea of infection control practices has been a while, and and then in the early 1900s, was when we started using barrier gowns and antisepsis. That came about because medical staff wanted to protect themselves against the infections that were being given by patients, and also it protected those highly infectious patients that, from spreading their germs to others. And believe it or not, it wasn't really until the 1970s that the Centers for Disease Control and Prevention began to develop and publishing guidelines for isolation techniques that were being used by the hospital settings. So over the course of time, and then by the 1980s, universal precautions came along. This was a new idea for strategy for the isolation techniques, and this evolved out of the HIV epidemic. It began to recognize that every patient is a potential source of infection and should be placed on blood and body fluid precautions. Then in the 1990s, CDC further expanded that concept of universal precautions to include contact with all body fluids, except for sweat, regardless of whether blood is present or not. And they changed the term to standard precautions. This is when we were introduced to those 3 transmission-based precautions categories, such as airborne, droplet, and contact. And these are the practices we continue today. I can honestly say that in my 30+ years of senior living healthcare experience, I've never seen any microorganism impact the infection control practices of COVID-19. Its volatility heightened our awareness of stringently following standard and transmission-based precautions. In fact, it sent us all searching for the same PPE at the very same time. Switching gears, let's look at the numbers. I'm sure, that, you're all aware of these numbers, but, I do feel it is important to review them in order to keep a perspective of where we are now in terms of this pandemic. When you look at national numbers, and this is from the data submitted to nursing homes as of February 7th. I even checked the website yesterday and it was still not updated, but there have been 631,427 confirmed resident cases and 542,443 confirmed staff cases, which brings us to an overwhelming number of 1,173,870 confirmed COVID-19 cases, and those cases resulting in 128,811 deaths. When we take a look at it closer to home for Pennsylvania, as of the 22nd of February, as a state had 79,116 total cases. 66,237 were among residents, and 12,879 were from the staff, which led to a total of 12,338 cases. Focusing on these numbers in and of themselves may have a significant emotional impact on us and the community, but as you can see in this slide, if we look at it a little differently, let's change it and look at the survival rate. As a nation, 1,045,059 persons survived COVID-19. That's an 89% survival rate, with Pennsylvanians' survival rate being at 84%. I just sometimes think that we hear so many different negative things and negative connotations that come with this COVID-19 that sometimes hearing something positive, I mean, that's a heck of a survival rate when we're looking at this from a national and state level. So, we are doing something right when we're looking at this. Moving on, we're going to look at the regulations. We're shifting gears again, and we're going to look at those the regulatory implications that COVID-19 has had. And although I'm going to be referencing a lot of CMS regulations for nursing homes, I do believe that the core principles that apply to assisted living residents and personal care homes as well. And, it wasn't, a year ago in March of 2020, is when CMS decided that because of the cases of COVID-19 excelling, that they were going to suspend all non-emergency survey inspections across the country to allow inspectors to focus on the most serious health and safety threats like infectious diseases and abuse. So the survey agencies were tasked to complete a focused survey to investigate compliance with regulations, with your regulations of the Infection Prevention Control Program, your reporting requirements to the residents and representatives and families, and also your policies and procedures that you have in place for volunteers and staffing in emergency situations. So basically what they were scheduled and set up for were to review the following areas. They were going to look at the overall effectiveness of your IPCP, including those specific policies and procedures as related to COVID-19. They're going to be observing your standard and transmission-based precautions They wanted to look at the type of quality of resident care practices for all residents, but especially for those COVID-19 cases, if that was applicable. They're going to look at that facilities and surveillance plan of the ongoing monitoring, looking at visitor entry and facility screening practices, and education monitoring and screening of facility staff, looking at facility policies and procedures, as we said, to address those staffing issues that we've all had through COVID-19, and how are we communicating with our residents, representatives, and families. I want to say right now that COVID-19 did bring these focus surveys and heightened our awareness of infection control practices. But I advocate strongly that we're always survey ready. And when I say survey ready, what does that look like? What does that mean? Well, for me, I relied heavily on what I call the survey prep book. It advocates that you have, we know what they're going to be looking for. We know the areas that they're going to be looking at, especially with this focus survey. So it's good practice, best practice, to have the current information regarding your facility in these areas of monitoring and education and screening and your policies and procedures that they're going to want to look at. You want to have them really at your fingertips, so that if surveyors are walking in your door, a surveyor walks in your door, that you can show that, hey, we're ready for you. We have our ducks in a row. I learned a long time ago that how we present ourselves in those first few minutes of engagement with that surveyor really does set the tone for the rest of the survey. I always also want to advocate that when survey ready means is that we're doing things by our policies and procedures consistently every day. It's just not when the surveyors are in the building. I know we have a heightened awareness, and we want to let our staff know that surveyors are here, because we do want them watching their P's and Q's, so to speak. But really, their everyday routine, the care that they're delivering, the services being provided by all departments really shouldn't be affected. We should be doing what we're supposed to be doing every day. And let's talk about that, your staff. We need to know and ensure that staff know how to communicate with the surveyors. What do they tell them? What don't they tell them? And typically it's just communicating with your staff on an ongoing basis about some of the questions that the surveyors might ask, so that they're ready to do that. And if they don't know the answers, it's okay to say, I don't know, but let me go get somebody to find that information, or let me go look that up, so to speak. So surveys are always challenging, so we want to definitely put our best foot forward. For now, I would like us to do a little quiz. We're going to take a quiz to see how you and your team are performing in maintaining compliance and being survey ready. So I'm just going to ask a few questions and answer this honestly. We always want to do well on tests. I speak from experience. You always want to exceed, but I also think that we need to be honest with one another and honest in our practices, because it truly identifies the areas that we have an opportunity to improve on. So it's good to recognize strengths. It's also good to recognize our weaknesses. So let's talk about your infection prevention and control program. First question, is it current and based on national standards for undiagnosed respiratory illnesses and COVID-19 as of today? Second question, does it include current reporting requirements to your local and state public health officials? Have all of your current staff receive COVID-19 related education as updates as needed? And when I say current staff, that could be someone who was hired 6 months ago, or maybe someone who was hired just a week ago. So we need to make sure that we have that ongoing education. Another question, would your staff be able to answer questions appropriately regarding your infection control practices? Are you routinely informing residents, their representatives, and families with COVID-19 related events? Let's move on to a next category, standard and transmission-based precautions. Are you observing your staff on an ongoing basis for appropriate performance of hand hygiene and cough etiquette? Are you verbally and/or visually communicating hand hygiene practices and cough etiquette to your visitors? Are you consistently watching staff on how reusable medical equipment and the environment are being cleaned and disinfected? When was the last time you checked your staff on appropriate personal protective equipment competency? And are your transmission-based precautions being implemented as protocol, as your policies state? In our last category, we're going to focus on infection surveillance. Are you up to date in identifying, tracking, monitoring, treating, and/or reporting of fever, respiratory illnesses, and/or signs and symptoms of COVID-19 for residents and staff? Who is screening all visitors and staff upon entrance each time they enter the building for fever and signs and symptoms of illness? Where is it being documented? Is it being documented? Remember, if a staff member leaves the building to go run an errand or run out for a smoke break, every time they come back, their temperature should be monitored and for signs and symptoms. I know a facility has been cited because they went out for smoke break, they came back, no one monitored them. Even in that short of absence, it was cited. And then the last question is does each resident's health record include the routine monitoring for fever and signs and symptoms of illness? So how did you score? Well, kudos to you if you scored 100%. Keep doing what you're doing. If you didn't score so well, hey, it just means that you are human and you must probably have become fatigued with this ongoing saga of COVID-19 and need to revitalize yourself and your staff to ensure ongoing compliance. You know, I personally recommend, if you don't already have it, obtaining the CMS's COVID-19 focused survey tool for nursing homes to use for your routine auditing. Okay, so let's look on and we'll move on to our compliance. And it's interesting, even though there is a pandemic going on, CMS, does urge all state survey agencies, along with the healthcare facilities, to maintain their compliance with all current CMS requirements and safety standards. That right now, they're especially focusing on infection control procedures. But what that means is that at any time they're in their building and they might see something else not infection control related, they are able to cite it. And so we want to always make sure that we are doing everything we're doing. Sometimes we get so focused on COVID that we might lose sight of some other areas that we should be equally monitoring as well. And so, again, in order to make sure that we're current, you have to diligently routinely monitor the CDC's website and your public health websites. And I know for myself, it's challenging because you keep seeing, it seems like you keep seeing the same information over and over again, and sometimes it gets redundant and sometimes it gets depressing. But it's that one time that you don't read the entire update, or the memo, or that you don't check that website, that one time, and that's when it has that new update. So we want to make sure that we're doing our due diligence when it comes to that as well. And it's certainly, having those current policies and procedures are necessary to comply with those local, state, and federal rules and regulations. But I feel the process of maintaining compliance is where I would like to focus. It's all good to have those policies and procedures in place, but if we aren't communicating those policies and procedures, and we don't have a process in place to monitor to make sure that we're maintaining compliance, oftentimes we're setting ourselves up for failure. So, it would be impossible to cover each policy and procedure related to COVID-19 within the time constraints of this webinar. So I want to focus on some general principles regarding processes. First, again, here I am quizzing you again, or I want you to just, these are questions that I want you to ask about your current policies and procedures. When was the last time you and your team reviewed your COVID-19 policies and procedures? It's not one of those one and done. I know we made, a diligent effort back in March and April and June as things were rapidly changing, to make sure that things were reviewed and revised. But, when was the last time we really took a look at them? And are they still applicable? Have we determined how frequently to check that CMS, CDC, and state health department website? And who have we designated to check these sites? And what happens if there are changes in standards of practice? What do we do from there? Which brings us to the next process. It's when a policy and procedure is new or revised, at a minimum, two things need to happen. First and foremost, when we're looking at a new policy, or when we reviewed it and revised it, you need to put that date the policy and procedure was reviewed, include it within that policy and procedure itself, along with the initials of the person reviewing. Or if it's a newly developed process, you want to make sure that you are including a date of implementation. This is very important because it establishes the timeline. It says that at this time, on this date, we went in and we reviewed our policy and procedure, and it wasn't current, so we revised it. Or it was current, and we're going to continue with it. That timeline from a regulatory compliance issue is I think is very important, because you can then go back and say, because sometimes when a surveyor comes in, they might be using standards that, comparing, when they're looking at documentation in the past, they're looking at the standards for today and not for the date of when that event actually occurred. So it's very important to make sure we establish that. And then again, once we have that policy and procedure, whether it was revised or whether it's a new one, we want to make sure that we've got it communicated. Like I said, keeping everything all to yourself does not do anyone any good. We got to get that information out there. So, here's some questions I want you to ask yourself. First and foremost, who do we need to communicate with? Who is it that needs to have this information? If it is the resident or the representative or the family member or visitors, your suppliers, whoever's coming into your building, I say it's best practice to deliver that information in a manner, that could be written or verbal, in a language, meaning that if they speak a foreign language, we need to make sure that we have somebody that can interpret for them so that they understand what's going on, and using terminology that they're able to understand. I know sometimes we like to use big words, being in the health profession, but if the resident or the representative or the visitor doesn't understand that terms, they're not going to comprehend it, which means more than likely they're not going to follow it. They don't know how to follow it or what you're talking about. When it comes to your staff, you know, you are going to want to set up that education or training program. You're going to have to develop one, you know, and then from there you want to implement it and implement it in a timely process, in a systematic process, in order to make sure that each and every person that needs to be informed has been informed. Also, an important part of that is to make sure that they are knowledgeable. You know, that I can sit here and shake my head and say, yes, I understand. But when when you have me take a quiz, I can see how much you understand. And if there's areas that I need to further explain to you. That goes along with skills competency. When we're looking at it, you know, again, I can say that I can do it right. And but you know, return demonstrations, show me how you do it, and I can determine if you're doing it right. And if you're not, it gives me another opportunity to educate you and to teach you. So I think it's very important process for that as well. The other part is when we're reviewing or establishing new policies and procedures that are including medical equipment or some other type of equipment or supplies, part of that plan needs to be developed to obtain all the necessary equipment and supplies prior to implementing that policy and procedure itself. If we say we're going to use a new device and we implement, but the device isn't going to be delivered for 2 weeks, but we want to implement the policy now, again, we're setting ourselves up for failure. So that's part of the process. We also want to make sure that if equipment and supplies are part of that policy and procedure, that we have plans in place to ensure there is adequate equipment and supplies available to the staff 24 hours a day, 7 days a week. And then another final or vital component of this process is the surveillance part of it. This is necessary to assure that adherence to policies and procedures are consistent. You know, when this comes around, you're going to need to designate a person or persons that are going to do the observation and check knowledge of the policy and procedure. And you're going to determine how frequently are we going to perform this surveillance? How frequently are we going to look at hand hygiene or cough etiquette or use of, you know, donning and doffing of personal protective equipment? So this all needs to be established. And, you know, it also, you know, as the staff are being surveyed, you know, it's important to compliment them on what they are doing well and offer non-judgmental education on areas needing an improvement. And when we get all the data together, and if we see some patterns and trends that are going on, that it's not just one employee doing it, but several employees, it gives us an opportunity that, hey, we need to relook at this policy and procedure. We need to look at maybe re-educating, checking competencies again, you know, whatever that might be. And so, you know, I always say start with an action plan, which brings us to our next part of compliance is action planning. And that, you know, action planning is identifying the opportunity for improvement. So, you know, it's when we see a pattern and trend and it's an opportunity for improvement, we define what is the problem? What is it that is going on that we need to fix? Next, we want to know, what do we want to achieve? What is our goal? What is the desired goal? And I caution you when we're setting up action plans to maintain compliance, to be realistic in your goals. You know, to have 100% compliance by 10 days from now, you know, you could be setting yourself up for failure, you know, but, you know, be realistic. We want to have 90% compliance within a week, and then we want, you know, gradually introduce it. But, you know, every problem needs to have a goal. And then to get to that goal, we have to establish some realistic strategies. What actions are we going to need to reach in order to reach our goal? And so when we're looking at those strategies, we want to make sure, who needs to be involved, with these interventions, these strategies, who needs to develop the strategy, who's going to be educating, who's going to be the implementer, who's going to be the overseeing, how are we going to accomplish, putting our strategies into place? Are we going to, we're going to establish duties, education competencies, again, go along with this. And when does this need to happen? Establish a realistic timeline, depending on the nature of the opportunity for improvement. If it's a real safety issue, it might mean that you do have to get all staff educated and check for competency within 24 hours. If it's something that can wait a little bit longer, then you take your time in developing that. Part of implementing the action plan is to ensure that everybody is on board with this, with the same strategies, with the same goal, having the same recognition that this is a need that we need to change. Because a key to compliance is definitely having that buy-in by all staff that are involved in that project or that action plan. Can't stress, diligent surveillance is a must. We have to be, even sometimes I know we don't want to, but we have to force ourselves to get out there and make sure that we're maintaining compliance. And it means doing it on a daily basis, ongoing, and it takes a team effort. It's not just one person out there watching for compliance. It's having everyone, like I said, buy into it so that we all have each other's back, so that we can openly say, hey, I noticed you didn't wash your hands, or you didn't use that alcohol scrub, this past time. Just a friendly reminder that you need to do that. We have to have each other's back, because the overall safety of each other, ourselves, and our residents comes to play. There are some, as it relates to COVID-19, there's a few action plans that you may already have in place that I kind of want to go over some ideas with. And that's, to have transparent, routine communication with your resident, their representatives and families, on that required events regarding COVID-19. But you know what? I'd also advocate to you to also communicate the positive events happening within your facility as well. Maybe you have had no new cases of residents or staff cases, or maybe you had 20 cases, and out of that 20 cases, you had 100% survival rate. Celebrate those successes. Maybe you implemented a new activity or dining program to enhance the quality of life. So, I know that we have to report sometimes those negative things that are happening, but hey, there's no reason why we can't, report the positive things as well. Definitely, you should have an action plan for tracking, trending, analysis, and reporting as required your resident and staff infections. Again, best practice is to have this completed on a routine basis, by a designated person. If you have an infection preventionist, this is the person that you should have in place. But make sure that person has a backup. Because that person might come out, and if they're, we need somebody to pick up, to not let the ball stop rolling, so to speak. Okay, we could also possibly, what is our routine screening and monitoring of residents, staff, and visitors for the signs and symptoms? Who's that designated person to routinely check for compliance, to make sure that we are taking temps and recording them, and recording for signs and symptoms. And I do know from a regulatory perspective, if you have blanks on your log, that can be seen as non-compliance. So, like I said, making sure we're doing our due diligence. And again, I do truly advocate that we have a schedule of education and retraining and reminding our staff of COVID-19 and our infection control practices. I know sometimes it gets redundant, but sometimes we need reminders as well. And so that's both in check of knowledge and competency. It is strongly recommended that documentation occurs with each action plan, including all efforts made to ensure compliance. For example, the inability to have the appropriate PPE. Every effort you made to get the necessary supplies should be documented. The date, the time that you tried to get that, who was contacted, when did I contact, what did they say, when should I expect them? Again, it's showing that our intentions are good. We really do want to do what we're supposed to do. Sometimes our hands are tied, but show what we've done to obtain the goal, so to speak. So sustainable and continuously followed action plans are key to ensuring that ongoing compliance with standards of practice, rules, and regulations. So let's talk a little bit about consequences. From March, this data is from March 4th through October 30th. The Pennsylvania Department of Health conducted an infection control survey in each of their 690 nursing homes. Overall, during that time, they conducted 1,200 plus surveys. Remarkably, kudos to you, 92% of these inspections did not result in any infection prevention and control program. Yes, and so that's great. That's 92% of that. And of course, we know that for those citations that did occur, most likely it was F80 that had to do with your program. And there was also some for establishing that emergency situation for staffing. And then there were a few that were cited for that, COVID-19 testing. Unfortunately, kudos again to you guys. Due to great efforts by all staff, there were only a few inspections that I saw that resulted in an F80 immediate jeopardy citation. And that was an example of one of these, is that the facility just failed to consistently maintain their infection prevention and control program to mitigate or potentially control the spread of the coronavirus. They failed to consistently educate staff on infection control practices pertaining to COVID-19, and they failed to follow the CDC guidelines to actively monitor positive COVID-19 residents. So it just goes to reiterate the fact that having appropriate infection prevention and control policies and procedures are only the first step in compliance. Competence and continuance to adhere to your infection prevention and control program is the second step. So having sustainable action plans in place will minimize that risk of non-compliance. As Jeff mentioned earlier, we did ask our colleague Christy James to join us to provide some insight to potential claims and litigation consequences. Unfortunately, she was unable to join us live, but has provided this brief recording for us.
Absolutely. Thank you, Cathy. And please allow me to just say hello to everyone listening. I am certainly no stranger to litigation. I am a former litigation manager, currently a paralegal, and today I have the honor to be a part of the claims mitigation team at AssuredPartners, where we focus solely on reducing the exposure that comes with professional liability claims, that is civil litigation regarding a resident injury. I'm extremely happy to say, and I'll have to knock on wood, that while we work with over 3,500 plus facilities, our team has received very few lawsuits related to COVID-19 to date. Now, is that because society understands that you are courageous individuals who cared for the most vulnerable during an unprecedented pandemic? Maybe. Is it due to liability shields, Possibly. Or is it just too early to be seeing those lawsuits? Probably. So we get a lot of questions about the liability shields, and honestly, any answer that I give you today may change tomorrow. In the absence of a federal COVID-19 liability shield means protections for a third-party COVID-19 claim will occur, if at all, at the state level. So while insurers may welcome any liability protections, the state-specific approach has really created inconsistency across the country. But please note, even with the shields in place, plaintiff attorneys are, of course, pivoting their strategies and allegations to attempt to null any immunities. A plaintiff attorney only has to throw in 3 simple words to move the lawsuit in front of a court to rule upon if the liability shield bars the claim. And those words are reckless, willful, and wanton. Now, I'll give you the best advice that I have when it comes to defending yourself from COVID lawsuits, and I'm sure that you've heard this before, but you as healthcare operators must create a timeline. So it's a timeline specific to your venue, your state, as to what the local, state, and federal guidance was at any particular time. So if you've not done so, if you haven't created such a timeline, I strongly encourage you to go ahead and do that now. What were the CMS guidelines in March of 2020? What were your state guidance in April of 2020, and so on? The lawsuits that are being filed today are holding you accountable for not what you knew when a resident expired from COVID, say in May of 2020, as an example. They are holding you accountable for what we know today in February 2021. That's why those timelines are so important. The standard that defense attorneys will use to defend your care and the decisions you made was, did you act reasonable? Did you act in a reasonable way to protect your residents with what information you had at that time and what PPE was available at that specific time of the alleged injury? I want to take this time to thank everyone on this call for showing up this past year, for putting yourself at risk to care for others. You know, we at AssuredPartners are here to support you, and should you experience a claim or a lawsuit, we will walk right beside you through the process. Cathy, at this time, I'll pass it back to you. Thank you.
Okay. Well, thanks for Christy for providing us that information. The last consequences I want to focus on is to our residents. You know, when the pandemic started, you know, it became necessary for all of us to focus most of our attention, you know, on infection prevention and control practices to protect the physical health of our residents and our staff. But in what other ways has this pandemic affected our residents? Consider this. Their right to receive visitors of their choosing at the time of their choosing has been restricted. Group activities that meet their interest have been reduced significantly or maybe even eliminated altogether. They possibly can no longer dine with others, and their ability to leave their room and move about the facility has been restricted. The fact is, their entire life has been significantly altered, and it's no wonder why we are seeing increases of depression, anxiety, agitation, and other disruptive behaviors with our residents. Also, as a result of having those things going on, we have more residents with weight loss, development of pressure injuries, decline in activities of daily living. The list could go on and on. But I want to focus on our future. You know, as national numbers of COVID-19 cases and associated deaths appear to be plateauing or even declining in some areas, we must move forward into the new norm in anticipation of resumption of annual health inspections. I task you with this. Complete an assessment of your facility's ability to meet the physical, mental, and psychosocial needs of your residents. I encourage you to utilize the CMS critical element pathways, such as the behavioral and emotional status, activities, dining, and sufficient and competent nursing staff review just to get started. After you've done your assessment, gather your team and identify both your strengths and your opportunities for improvement. From there, develop a sustainable action plan for each improvement opportunity to ensure ongoing compliance and mitigate risk of citations, insurance claims, and litigation. Equally important, celebrate your successes. Let everyone know what you are doing right. Commend them. Have a celebration when we're able to do that. The final thought. COVID-19 pandemic has impacted us all. We are not broken, and we are becoming stronger healthcare communities because of it. Again, thank you for this opportunity to present. As a reminder, Christy James is not present with us today, but she has asked that any questions you may have for her be directed to her email at christina.james@assuredpartners.com. I will now answer any questions as I am able to do so.
Great. Thank you, Cathy. That was great information that you shared today. At this time, we will be open for questions. If you can type your questions into the question pane. We have a comment, just a thank you. This was great. So thank you for Sherry. Appreciate the feedback.
That's awesome. Good.
Any questions? We'll just give it a minute or two here. And again, just wanted to remind everyone that, PHCA does have webinars on a regular basis. We have one coming up next week on March 3rd and another the week after. And we also have our quality symposium coming up in the middle of March 18th, we start that. So take a look at our website. Again, we're adding new webinars as topics of interest come up. So take a look at that, and if it's something that you can benefit from or know someone that can benefit from it, please sign up for those. It's a great opportunity to get some free education. All right, this is a quiet group. We're gonna.
I left them speechless.
Really well, Cathy. That's great. All right, I will be sending the follow-up information in an email. Looks like we do have a question that's come in. Can you please comment on any protocols that have been implemented for non-vaccinated staff, if any?
Honestly, I have not heard of any protocols at this point. But if, Wendy, if you can, I will research. I will definitely research that. And I can get back to, if you have that person's name, I can certainly reach out and get the information, Wendy, and I can get it to you. But I would, it's a very good question, but I'm not able to answer that one at this time.
Hey, Cathy, it's Jeff. I'll give you my 2 cents on that. I mean, a lot of what I've been hearing is just enhanced PPE. So maybe instead of wearing, one mask, wearing two, wearing more of the face guards, things like that, to where, we at this point, I don't think many are making it mandatory or not allowing them to work if their staff is not vaccinated, but just enhanced PPE is kind of the direction that I've heard and seen.
Okay.
Yeah, I'm sure we'll be hearing more about that as time goes on, but that sounds like a good place to start with the enhanced PPE. So thank you for that question. That's a great question. Any other questions? We still have a couple minutes left here in our hour. So if you have any questions, please feel free to ask them. And again, I will be providing the contact information for AssuredPartners. So feel free to reach out when you receive that if you think of something later. All right, seeing no questions, I think we're going to wrap up. Again, thank you, Jeff and Cathy, for providing us with this information today. Now every time I get started here, we have another question. This is great. Here's another question that's come in. Can you comment on what to tell families when they ask why we can't mandate everyone to be vaccinated?
Jeff, do you have any ideas? I'm trying to think of something off the top of my hand.
I mean, I think it's more of the political answer, and I would probably you have to proceed with caution, right? I mean, so I would probably proceed with, well, we're giving everybody the ability to make their own decisions. We're doing everything possible to educate on the importance of vaccinations. We're celebrating, we're promoting vaccinations, through on-site vaccination clinics, word of mouth, social media. So we're doing everything we can to drive the participation in the vaccination clinics. But at this point, we've continued to make the decision, like many of our peers, and with the guidance of Pennsylvania Healthcare Association, that taking the mandatory approach may not be in anyone's best interest at this given time. So I don't know if that's the right answer, but I think you have to proceed with caution as you're delivering that response.
I agree, Jeff. And also another thought is that we can also communicate when they're asking those questions, that to reiterate that vaccination alone is not going to eliminate COVID-19. We still have to continue with the hand washing, hand hygiene, cough etiquette, wearing the mask. So sometimes I think the public has gotten the idea that the vaccine is going to be the cure, and we know that that's not the case, that the vaccine in and of itself. So along with what Jeff had to say, I think it's also reassuring to let them know that we're doing everything we can to get as many of us vaccinated, but at the same time, that's not the only thing that we need to continue to do. We need to continue all these other protocols that we have in place.
And also sharing maybe the successes that you have seen, the percentage of residents that are vaccinated, and the progression that you've seen maybe with staff. Maybe, and I know Pennsylvania has had a little bit of a lag with getting the vaccine, but as you go through your first vaccination clinic and then second vaccination clinic, hopefully we're seeing a positive progression that we can share with that resident or that family member that may be questioning on what we're doing to put their loved ones in the best possible position.
Great, that's great advice. Thank you so much for sharing that. Again, if anyone has questions, please feel free. We still have just a couple minutes here, but again, just take the time to check out the upcoming webinars that we have available. And thanks to Jeff and Cathy. We do have another question that's popped in. Any updates on vaccines for staff and residents after the third vaccination clinics are completed?
I would, my advice is that you need to stay tuned to your state healthcare associations. I'm sure they're giving you updates as to the availability for your individual state. I think each state is different on what the next step is. I know here in Ohio, where I live, we're still in determining what that next phase is. So, I don't want to speak to that, but I do say, keep in contact, checking the website and for the latest information on that process.
Yeah, and I would echo that as well, Cathy. And it's a moving target. So it seems to be changing every day on the next round of vaccinations, who will be eligible in the next round. And I think Pennsylvania Healthcare Association does a fantastic job of communicating pertinent information. So I would say with confidence, when PHCA knows, you'll know.
Yeah, I would agree. We've been having those discussions internally here, and you can feel, anyone can feel free to reach out to our staff here, who should be able to answer that. Chris Fisher, our quality director, Gail Weidman, who is our regulatory affairs person, Kevin Sissick, personal care and assisted living, any of our policy team You know, and if you reach somebody who can't answer that question, we'll get you in touch with one of those folks on our policy team who, again, if they don't have the answer when we do get it, we will definitely put something out in our daily blogs and on our website for sure.
And just one last thing I would add, Wendy. I mean, there's been, a couple of questions around the vaccinations, especially for staff, and that's an ongoing target as well. And, we kind of started the session with talking about, having a vision and an execution strategy. Well, none of us had this in our vision, right? It was a crazy curveball that was thrown our way. And so what we didn't have the ability to do is develop a definitive action plan. So I would say stay very creative in what you're doing. And the mandatory approach is a challenging one, and there's not many that have gone that route. But really promoting the successes on social media, challenging your department heads and leadership team on the importance of getting vaccinated, not only for them, but their staff is looking up to them on a consistent basis. So if my department head chooses not to, why should I type thing? So just continuing to promote the positive behind it, be there to field questions. And there's also very creative ways to incentivize that. If you do have some folks that are kind of on that fence on to get vaccinated or not, you might be able to put an incentive in place that can go that direction. And a lot of our carrier partners have been willing to participate as well through on the health insurance side with wellness funds and wellness initiatives. So those are some things that you can potentially lean on to help incentivize your staff without having to break your bottom line.
That's great advice. Thank you, Jeff. All right, seeing no more questions and being a little bit past our time now, again, this is all important stuff, and know that we do have a vaccination-related webinar or session during our quality symposium. So if you haven't signed up for that yet, there's still plenty of time. That starts on March 18th, and it will be held virtually. So one of the sessions will address vaccinations. So there may be some more answers, and I know things are changing sometimes by the hour. So if we don't have that information today, hopefully we'll have more information that's coming out later next month. So again, please feel free to be in touch with your association staff. And again, I want to thank Jeff and Cathy for your time and the information today. Please stay on to complete the survey once we're logged off here. And the webinar has been recorded and is available if you know anyone who can benefit from it. That link will be on our website likely tomorrow. Just want to thank our speakers and just have everyone have a great day and the rest of your week. Stay well.
Thank you.